Hello, everyone. Welcome to the first ever National Virtual Graduation Celebration for all dental public health graduates. My name is Eni Obadan-Udo, and I am the Program Director for the Dental Public Health Program at the University of California, San Francisco. I'm excited to be your host for today. As we all know, the class of 2020 has faced the unprecedented situation of completing their dental public health programs in the midst of a worldwide pandemic. We're so proud of all that they have accomplished, and today we join their program directors in celebrating each and every one of them. This event has been organized by the American Institute of Dental Public Health on behalf of all dental public health residency programs across the nation. I would like to thank the members of the planning committee, Dr. Mary Tavares, Dr. Francis Kim, Dr. Dave Capelli, Ms. Annalise Cochran, and Ms. Katie Skiggs, who have worked tirelessly in the background to put this event together. Once again, welcome everyone. To give opening remarks on behalf of the American Association of Dental Public Health, AAPHD, please join me in welcoming our president, Dr. Angeles Martinez-Mir.
Thank you. It is an honor to address you all and to officially welcome you to our specialty. What an exciting time to join the workforce as dental public health professionals. Never has our specialty been so valued and needed. You're joining our specialty at a time where there is a pandemic that has highlighted the need for dental public health professionals and has also stressed the role that social determinants of health and health disparities and inequalities play in situations like this. That, along with other events that have happened, has created a unique opportunity for you. So I invite you to utilize the knowledge that you have, your talents, your skills for the good of your community, both local, nationally, and globally. Be civically engaged, agents of change. This is the time for you to shine. This is a time where your chosen specialty can make such a big difference in this world that we're living in. I also invite you to stay close to our organization. There's strength in numbers, and staying close to organized dentistry and the means of our organization is going to give you a venue to effect that change that is very much needed. We are a diverse organization that strives to serve its members, and we are happy to serve you as our new colleagues. So in summary, as I said, it's an honor, a privilege to welcome you and to tell you that you could not have chosen a better specialty. And of course, I'm partial about that. I know that. So welcome to the light side of the force, if I may say. Welcome to being agents of change.
Oh, thank you. Thank you very much, Dr. Martinez-Mir. All right, so next, I'd like to invite Dr. Christopher Okunseri, the president of the American Board of Dental Public Health, to give his welcoming remarks.
Thank you, Dr. Baden, for the opportunity. So I want to say welcome to everyone on behalf of the American Board of Dental Public Health. We appreciate the opportunity to actually see you guys graduate. I understand there have been a lot of stress points here, but as dental public health professionals, this is not an unusual territory for us, and we strive in situations like this to put up our best. And this meeting is also another example of dental public health trying to do their best, irrespective of the challenges they are faced with at this point. So I thank you all for putting this together. I welcome the graduates to the specialty, and I know that if not all of you, but at least some of you are still looking up to the exam. We are working very hard to make sure at least the written part of the exam that most of you will be looking forward to taking happens at the end, happens sooner rather than later. But overall, we are glad that you guys have chosen to be part of our specialty, and we look up to you guys doing the best for the specialty as you guys work hard to become diplomates and to become good representatives of this specialty. Thank you very much.
Thank you very much, Dr. Kinseri. Next, please welcome our benevolent sponsor, Dr. David Capelli, to give his welcome message on behalf of the American Institute of Dental Public Health.
Thank you very much. Well, congratulations to all of you and welcome to our guests. On behalf of the American Institute of Dental Public Health, or AIDPH, I want to recognize your milestone achievement. You have chosen a distinguished specialty. Oftentimes, dental public health is referred to as the conscience of dentistry because practitioners of dental public health care about the community, are a voice for the underserved, and seek to reduce health inequities and barriers to receiving dental care. I challenge you, all of the graduates today, to continue to look for opportunities to improve the oral health of the communities that you serve. It's our pleasure to sponsor this event with the other organizations and to honor each of you today. On behalf of AIDPH, I want to extend best wishes for your continued success in dental public health. Thank you very much.
Thank you, David. Thank you, everyone, for your lovely and inspiring messages to the class of 2020. Class of 2020, as you can tell from these welcome messages, we are all so very proud of you. We're rooting for you and excited to welcome you into the community of dental public health specialists who are making a difference across America. The next item on our agenda is the keynote address. I'm extremely honored to be introducing our keynote speaker today, Rear Admiral Timothy Ricks. Dr. Ricks currently serves as the 19th Chief Dental Officer of the U.S. Public Health Service, as well as Assistant Surgeon General. He serves as the Surgeon General spokesperson on oral health and interacts with Chief Dental Officers from other countries, with military Chief Dental Officers, with leaders in organized dentistry, with state oral health programs, and much more. He's currently overseeing the development of the second ever Surgeon General's report on oral health. In addition to his role as Chief Dental Officer, Rear Admiral Ricks serves concurrently in numerous national roles within the Indian Health Service, IHS, including Continuing Dental Education Coordinator, Oral Health Promotion, Disease Prevention Consultant, Oral Health Surveillance Coordinator, Dental Lead for the Government Performance and Results Act, and IHS Representative to the Healthy People 2020-2030 Oral Health Work Group. Rear Admiral Ricks has served in the U.S. Public Health Service for over 20 years. Prior to this service, he was an associate dentist, independent contractor, and sole proprietor. And he also served as a military police officer in the Army National Guard. He has served in numerous leadership capacities within the U.S. Public Health Service, led multiple national initiatives, and is the recipient of numerous USPHS and IHS national awards. Dr. Ricks holds a Bachelor of Science degree from Delta State University, a Master of Public Health degree from the University of Nevada, Reno, and received his dental degree from the University of Mississippi. He completed a dental public health residency with the Indian Health Service and is a board certified diplomate of the American Board of Dental Public Health and a fellow of the International College of Dentists. Everyone, please join me in welcoming our keynote speaker, Rear Admiral Timothy Ricks.
Thank you very much, Dr. Ibadan Uda. And as she mentioned, I do serve as the Chief Dental Officer of the U.S. Public Health Service. And I'd like to thank the American Institute of Dental Public Health for the invitation to speak with all of you today. First and foremost, I'd like to join my colleagues to congratulate each and every one of you for a monumental achievement in graduating from one of your, from a dental public health residency. As a graduate of a dental public health residency myself and a diplomate of the American Board of Dental Public Health, I highly value and respect your commitment to dental public health. And I know that it was not easy going through a dental public health residency. In the past few months, we all know that our world has really changed. The novel coronavirus, officially called SARS-CoV-2, has wreaked havoc on all of us, from our daily routines to our healthcare systems, to our economy, and perhaps even to our own health of ourselves or our families. The first SARS, or severe acute respiratory syndrome, which appeared back when many of you were perhaps in grade school or high school even, only affected 26 countries and only had 8,000 cases and 800 deaths worldwide. This virus is a game changer, as we know. It's had devastating effects, and I just looked up the numbers for today, and as of today, over 8 million people have been infected worldwide and over 435,000 deaths, and this is continuing to grow. However, just as it has been since its inception, public health has been at the forefront of this pandemic. So as we begin to rebound, and we are rebounding from this crisis, each of you will undoubtedly emerge even stronger, even more resilient, and ready to tackle many challenges that lay ahead of you past your residency. As dental public health professionals, hopefully you'll be in high demand as you look upstream to plan and manage oral health programs, evaluate and recommend improvements to dental care delivery systems, conduct oral health surveillance to determine population-based disease burdens, conduct research that will advance our knowledge of oral health, and serve as an advocate for oral health and public health for many years to come. But we know dental public health is not an easy road to follow. You'll have many challenges along the way. Some of these challenges include things like the silos that we have existing in dentistry, in oral health, and across the healthcare fields. So one of your challenges will be to try to break down some of those silos of care, not just outside of oral health, but within oral health itself. And this disruption of COVID-19 has really given us that opportunity to look within ourselves at what some of those silos are and to start taking proactive steps to reduce or break down those silos. Integration of oral health and primary care, as we know, is bidirectional. So we must lead as dental public health professionals by example and embrace the fact that first and foremost, we're healthcare professionals and we're oral healthcare professionals second. So there are other challenges that you'll face, we'll all face together. The demand for oral healthcare continues to increase in this country. And as many of you graduate and go from your residency and go into the job market, you'll join 200,000 of your colleagues across the country in providing oral health care to Americans, but only a small number with your credentials as a dental public health specialist. There's been a 22% increase in the number of dentists over the last 2.5 decades in this country. But we still have an access problem in this country. We still have dental deserts. So with new dentists having an average debt of $292,000, last year's graduating class upon graduation, and having seen actually the number of dental health professional shortage areas remain kind of stagnant over the last couple of decades, there are great opportunities for us in advocating and actually practicing in those dental deserts, whether they're in rural areas of our country or where they're in metropolitan areas. That's why we need each of you as dental public health leaders to look at the value of things such as alternative workforce models, such as dental therapists, expanded function dental assistants, the community dental health coordinators, community health workers, independent or collaborative practice dental hygienists, and other models as possible solutions for this access to care problem. And according to HRSA, the most recent data that we have, 58 million people are affected by these so-called dental deserts. There are other challenges you're going to face as well. As we all know, dentistry is evolving rapidly. As we began the 21st century, we learned that oral diseases disproportionately affect people in poverty and people of certain races and ethnicities. And some of that has really been highlighted with COVID-19, as we know. Some of you may provide care or leadership in some of these communities or in programs or settings that target these populations. And hopefully with your newfound knowledge of dental public health, you'll embrace this challenge and help reduce these historic oral health inequities in both access to care and delivery of care by providing high quality and the needed oral health services. Another challenge we all face is this aging population. I know you've heard a lot about this, but over the next 2 decades, the number of adults over the age of 65 will grow to more than 70 million in the US, double what it was at the turn of the century. And by 2035, we'll have more adults over the age of 65 than under 18 for the first time. So as such, each of you in your leadership role, or if you're providing direct clinical care, you'll need to understand that this changing dynamic means that we need to embrace it and embrace changes in how we practice oral health, especially in a geriatric population. There are emerging public health threats other than COVID-19. And these are a challenge to dentistry, but also if we look on from a positive viewpoint, they're an opportunity for us. There are many threats such as e-cigarettes, smoking, substance abuse disorders, HPV-attributed oropharyngeal cancers, and others that have some type of tie to oral disease or oral health. Back in 2000, the first Surgeon General's report was released, and the main message of that report was that oral health meant much more than just healthy teeth, and that it was integral to the overall health and well-being of all Americans. So we've made that case, but that case has been lost on many people, and so we need to continue to reinforce that message. And in fact, we know as oral health professionals and dental public health professionals that you can't have overall health without first having oral health. And so as we welcome you to this specialty, we know that each of you is not only poised to provide high quality care if you're a clinician, but also that you'll emerge as leaders within your communities, within organized dentistry, and within the profession itself. So each of you has received a high quality dental public health residency experience. Your leadership, your knowledge, your experiences during your residency are going to pay off for many, many years to come. You will each embrace the challenges ahead, and your success in the future will depend largely in part on your ability to educate and inform others about upstream public health issues that affect oral health, and your ability to influence change in those that you speak with. So over the horizon, I see and hope for a bright future for all of you in our profession and in our specialty of dental public health. So once again, thank you to the American Institute of Dental Public Health. Congratulations to all of you. I look forward to seeing great things from all of you in years to come, and I wish you much success in the future. Thank you very much.
Thank you very much, Dr. Ricks. I truly appreciate that message, and thank you for reminding us about our roles as dental public health specialists and promoting oral health in the community. Now, for the reason why we are all here today, the dental public health class of 2020, the graduates are soon to be graduates. We'll move into the next segment, which is the graduate recognition segment of this event. we're going to do this segment a little bit differently. First of all, you're going to see a slide with the program name. And then I would call or invite the program directors to present their graduating class of 2020. If the program director is not available, I will introduce the graduating residents for that program. Every resident has a bio slide, which shows a picture and a response to one of 3 questions. For the residents, I ask that when your name is called, you wave and you smile so that everyone can see you and acknowledge you. After all the residents for your program are introduced, we ask that you all come back on so that we can have a screenshot for your entire program. Once we are through with all the programs, all program directors and graduating residents will be invited to come back again for one large screenshot of all the programs and graduating residents. So with that little bit of housekeeping out of the way, let's begin. The first program is AT Still University. I invite Dr. Jeff Chafin to introduce his residents.
Welcome, everyone. So AT Still, we have a combined MPH and dental public health residency. I think this is about our 5th year, and so we are part of the College of Graduate Health Studies for AT Still. And the resident that I wanted to introduce today is Dr. Shreya Palakar, and so she's lives in Michigan, and she has just completed our program, or will complete that program real soon. So I wanted to say congratulations to her for being a great resident. Thanks.
All right, thank you. So then we'll move on to the next program, which is Boston University. And if we can put up the slide for that. Okay, thank you. So on behalf of Dr. Catherine Hayes, I'm going to invite Ms. Thea Scott to introduce the residents. Thea? All right, okay. There you are.
Here I am. Great, thank you. I'm excited to be able to present our wonderful DPH graduates. Let's see, how do I do the screen? Wonderful. First, we have Dr. Adima Lafi. She is completing our program in the doctoral degree. Next is Dr. Iman El-Jagaiman. She is also a doctoral student in our program, or completing the program. Next is Dr. Preeti Singh. She is completing a master's degree and residency in dental public health. Elizabeth Powell is completing her residency in our program. Dr. Christine Chow is also completing a residency in our program. Dr. Pratyusha Chava is completing a residency in our program. Dr. Kirandeep Sandhu is completing a residency and a master's in our program. We are so proud of all of them. And congratulations to everyone. Everyone's done great work.
All right, thank you, Thea. So if I can ask everyone to just unmute themselves and put on your video so we can take a screenshot for the program. Smile if you want to see DPH. All right. Okay.
Good work.
Thank you. So then we'll move on to the next program, which is the CDC program. I'd like to invite Dr. Gina Thornton Evans. think you're on mute.
Thank you. Thank you. Oh, wrong slide.
Oh,
Oh, there.
right. Okay.
Okay.
Excellent.
Good afternoon, everyone. I'm Dr. Gina Thornton-Evans, and I'm pleased today to congratulate Dr. Marcia Parker. She has been a resident with the CDC for the past 2 years doing a part-time residency, and it's been a delight to work with her. And I'm really proud of her because she managed working a job as a program services team lead, but also to complete her residency, and most recently published a MMWR focusing on prevalence and trends over time in severe tooth loss among adults aged 50 years and older with certain select conditions. So I'm really very proud of her, and I know she's going to go on to do great things. Thank you, Dr. Parker.
Thank you, Gina. Thank you, Dr. Parker. So we'll just do another screenshot for your program. Thank you.
Thanks.
All right. So the next program we have on is Columbia University. The program director, Dr. Kavita Luwalia, could not be here today, so I would introduce her residents. All right, so we have Dr. Danny Kalash, and his quote here says he'd like to thank Dr. Aluwalia, Dr. Adelston, Dr. Kirk, and Dr. McManus. If you like to unmute yourself and put your video on and just wave to the audience. Danny? All right, okay. Thank you very much. Okay, the next program we have is the Harvard School of Dental Medicine program. I'd like to invite Dr. Mary Tavares to introduce her residents.
Thank you, Annie. It's a pleasure to be here and pleasure to see this whole event happening. It was a great idea, and I want to thank you for thinking of it. So here we go. So at Harvard, we have a couple of levels. We give a doctorate, a master's, and a certificate, and the certificate is given to everyone within. So I have a group that has accomplished many different things. So my first is Dr. Muwath Al-Dasari, who I want to congratulate for getting his doctorate degree a few weeks ago, and he also completed the certificate. And next, Dr. Sheikh Al-Dukail also completed her doctorate degree a few weeks ago and had already completed her certificate. And I do want to mention that both Sheikh and Muwath are going to be joining us as part-time faculty this summer. So I'm excited that they aren't leaving just yet. And then they'll go on to their lives after COVID. Next is Dr. Jave Nelson. She has also completed the doctorate program and completed her certificate, and has been accomplished an awful lot in our program. I'm very happy to see her moving on to her next stage in life. Dr. Naila Tillman completed a master's in our program and certificate, and Naila started her pediatric residency, so I think she isn't with us today, but I know that she would have loved to have been. Dr. Hisham Al-Hazmi is finished his residency. He got a certificate. He will be staying on for a doctorate degree. Dr. Fed Al-Ghazi also completed his certificate and also will be staying on for a doctorate degree. And Dr. Nora Alamer has also completed her certificate and will also be staying on for her doctorate degree. But officially, they have all entered the world of dental public health and eligibility to move on to the next stage of their lives. So hi, everybody. You can unmute and say something real quick or clap.
Thank you.
Yeah.
Hello. Thank you.
Muwath has his mask on, of course. Okay. Hi.
It's my walking routine. So
great. Good to see you guys. Congratulations.
All right, congratulations. The next program up is the NIDTR program. I'd like to invite Dr. Bruce Dye to introduce his residents.
Hello, can you hear me?
Yes, we can.
Oh, good. Can you see me?
Not yet.
Oh, thank goodness. I would be unrecognizable to everybody out there in the great big wide world. I have a couple of folks that I would like to introduce to the crowd who is receiving a certificate from us this year. As you may or may not know, our program is a combined program with the National Library of Medicine, with dental informatics, as well as dental public health. The first person I want to introduce is Dr. Demetrius Williams. And as you can see from Demetrius's photograph that she's provided to us, she's in the Army. So she will be leaving us with a certificate in dental public health and a certificate in dental informatics, and will be going back to the Army to make major changes at the Department of Defense. What those changes might be, I don't know. The next person is Dr. Munder Ben Umran. Munder also is going to be leaving our program with a certificate in dental public health and a certificate in dental informatics. And Munder is currently looking for a job right now. So if you know of anybody out there who needs a highly qualified person who has experienced a wonderful residency experience, he will be much interested in hearing from you. Thank you both.
Thank you, Dr. Dye. Thank you for that plug. So, and this goes to all the residents as well. I mean, once we go into the happy hour, feel free to reach out to people if you're still searching for jobs. All right, smile and wave so that we can get a picture. All right, thank you very much. Okay, so we'll move on to the next program. And which is the Eastman Institute for Oral Health. I'd like to invite Dr. Badner and Dr. Gajendran to introduce their residents.
Video.
We can hear you.
Hi, this is Sangeeta Gajendra. I'm waiting for Victor.
I can see him on.
You can?
Yes.
Yeah. Hello.
We can hear you.
I don't know where's
really.
Okay.
Right as I think we were about to go, I lost the feed from Zoom. It's interesting. The timing couldn't have been worse. Hello, everybody. Sangeeta, are you there?
Yes, I'm right here.
All right. It's my great pleasure to announce the graduation of Dr. Chelsea Foss, who's been a remarkable resident with us this year. We have a very small program, but we in New York City. But we're actually connected with the program at the University of Rochester, as well as with the State Health Department in New York, in Albany. Dr. Chelsea Foss's interest in particular is those with developmental disabilities. And her research has been, will be quite remarkable with working with MEPS to identify the difficulties that those with intellectual and developmental disabilities have accessing dental care. It's just remarkable. And it's been a remarkable one-year experience that we've had with her. And we had just received notification that we had received one of the HRSA grants and expected Chelsea to be with us as one of our project managers for the next 5 years. And we're all excited about it, only to find out that yesterday she accepted the position as the Senior Health Policy Analyst at the HPI at the ADA to work with Marko Vucicic. I've always said Marko was a man of great taste and great judgment, And he proved it once again because he stole one of our stars. But I don't think of it as a personal loss because she's going back to be closer to her family. At least that's what she told me. But anyway, so she's going back to her family, and we wish her with great warmth and regard. You will not hear, this is not the last we will hear of her, and you will hear of her. This is Dr. Chelsea Foss, and I'm very proud to have been her mentor here in New York.
Congratulations, Chelsea.
All right, congratulations. I have seen your name so many times in all the emails that she has sent out to organize the class. So I'm excited to welcome you into the dental public health community. All right, so smile, wave, and then we get the screenshot. All right, okay, thank you. Thank you so much, Dr.
Did it come the way the...
All right, so we'll move on to the next program, which is the North Carolina Division of Public Health. The program director is Dr. Alex White. I understand that he's not on right now, so I would introduce his residents. Next slide, please. All right, so the first resident we have is Dr. Jessica Norris. If you could please put on your video and wave to the audience. Jessica, are you there? I thought I saw you just a minute ago. All right, and then the second resident is Dr. Sarah Lohman. All right, okay, there you are. Thank you. All right, okay, so wave and say hello. Thank you, congratulations to both of you for completing your programs. All right. And then the next program we have is from Temple University. Program director is Dr. Marisol Tellez. She also couldn't make it today, I believe, and she has one resident who is graduating this year. We can move on to the next slide. Okay, yes, we have Dr. Arjun Deo Singh. He would like to acknowledge his dean, Hamid Ismail, his program director, Marisol Tellez, and Dr. Vinod Bhupathi, Dr. Mana Muzaffaran, and his family and friends. Thank you. Congratulations. All right. Okay. And then we move on to the next program, which is the UT Health San Antonio program. It's run by Dr. Saman Chala. And on his behalf today, we have Dr. Ratisha Marwaha.
Yeah.
Okay.
Hi, everybody. This is Dr. Ratisha Marwaha, and I am representing UT Health San Antonio School of Dentistry. I would like to congratulate Dr. Salma Al-Wazir, who will be the graduating resident for the year 2020. She is an amazing resident to work with and is extremely passionate about serving the underserved communities. And I hope that she makes her dreams come true. So congratulations, Dr. Al-Wazir. Also congratulations to all the graduating residents.
Thank you very much. All right, please wave Dr. Al-Wazir. Okay, thank you.
Thank you.
All right. Okay, the next program is the Texas A&M College of Dentistry program. I'd like to invite Dr. Peggy Timothy to introduce her residents.
Hello, Annie. It appears that Peggy may not be on.
Oh, okay. That's okay. I can see Dr. Ragad Baidat. Did I get that correct? Okay. Yeah, congratulations to you. And Dr. Cara Ortega as well. Okay. So Cara, if you can put on your video so you can wave and we can know who you are. All right. Okay. Congratulations to both of you for completing your programs. And then the next program we have is the University of Iowa. The program director is Dr. John Warren. He also couldn't be here today. So if you could move to the next slide, I would introduce his residents. All right, so we have Dr. Adekube Olayinka. She'd like to acknowledge Dr. Warren, her thesis mentor, and for his support throughout her learning program. Dr. Adekube Olayinka, are you there? I do not believe I have your video. All right, excellent. Okay. Well, congratulations. And last but not least is my program, University of California, San Francisco. I have 3 residents graduating this year, and I'm super, super proud of all 3 of them. They have worked so hard, given all the changes that have had to be made due to COVID and in order to complete their programs. So I'm really happy and proud of all of them. First slide, please. All right, I'd like to introduce Dr. Navita Kaler, if you could wave. Yay. All right, the next person is Dr. Ankita Bala. All right, third, Dr. Karen Raju. Okay. Congratulations to all 3 of you. They're also looking for jobs. So if anyone has any jobs available, please reach out to me and I can connect you with them. Karen is interested in working with the special needs population. Navita is interested in health services research, and Ankita has worked also with on an autism project, as well as composite score creation for the city of San Francisco. So congratulations to all 3 of you.